three doctors here at Gillette primarily, and I consider them the keepers of Katie's information, kind of the core team. And they've helped us to seek other professionals that maybe work in other areas as well.
When we first started coming to Gillette, we just came for orthopedic surgery, and her doctors were spread all over the Twin Cities, some at Children's, some at the university, and they all had their different offices everywhere, and it was kind of complicated to keep track of everything at that point. And as Gillette has taken on more and more specialties, almost all of her doctors are here now, and it's seamless, you know, to be able to have the doctors communicate with each other. Sometimes I can even get 2 appointments scheduled in the same day from different specialties, and it really is great to have them all here in one place.
It's been great, the relationship between our primary care physician and the Gillette physicians, in that the Gillette physicians always send copies of all of the progress notes, all of the information, medication changes, test results to our physician. So when we go in to see our physician, she is able to say, okay, well, I just saw you had a blood level on whatever it was. And she can kind of keep track of it, and she can help say, okay, I know you're seeing this specialist, have you thought about this? And she helps coordinate all of the different specialists, so we have like one place where everything can go.
I think if you don't know the system, it's going to be hard. I think that it's hard when a doctor says you have to try to figure this out and you're not given resources. So the more resources, the better. I think that investigating everything that's needed for your son or daughter, you just gather information and just keep on going.
I don't know that any other hospital has anything like we do at Child and Family Services. We really have really comprehensive care for the families and for the patients, and different resources that we can keep up with them and keep checking in with them, and I think we have that follow through that's really great that not everywhere else can offer. I think one thing, we're small enough as a facility, and we really are connected, and we really know our providers and our nurses well, so we can communicate back and forth and really get information where it needs to go.
I've really liked that with Gillette, almost all of our specialists are with Gillette. So we have a physiatrist and a neurologist and an orthopedic surgeon, and they all communicate to one another. We try to kind of piggyback on appointments so we can hit one and then follow up with the other one. They also do a good job of trying to coordinate, so whatever the family needs are too. So it's not just about Ryer, but what our entire family needs and how we can best coordinate that with all of our physicians to make sure we're meeting Ryer's needs, but still doing what we need to do for the whole group.
Advocate, advocate, advocate. Be the one who pulls it together. Contact the doctors if you feel like there's something that you need to connect information between other sources with. But I found that I have to be the one to speak up, and not just so much even at Gillette, but also in the schools.
I think at Gillette, we're one of those hospitals where the families have multiple providers due to their conditions and different things that they need to get care for. Specific to social work, I think that we help a lot of families try to connect with the right providers, their resource nurses, or just that person that's going to be able to answer the question that they don't otherwise know who to call about. I think a lot of our other providers in our department, our psychologists and our child life specialists, they do a lot of outreach with schools, and they can really be that point person to help with different transitions for them there. So I think we really do a lot of navigating the system in and out of our hospital.